The first part of a knee examination is the gait. Watch how your patient walks to see if there's any abnormality, such as a limp. And then once that's done, onto the couch to examine the knee. Expose the knee and make sure they're comfortable. For this examination, we're going to be examining the right knee. And the first thing to do is just to look, and to look to see if there's any abnormality. Always compare with the other side. And things to look for is the colour. Is there any redness? Is there any swelling? Small effusion can be felt or looked for just on this little fossa area here. We'll look full, and looking for any scars or any abnormalities in the knee itself, such as a varus or a valgus deformity. Once we've inspected the knee, the next thing to do is to move the knee, and the knee moves in extension and flexion. So the first thing to do is to look for any problems in extension and compare to the other side. So extension will just be lifting the knee up, and this knee actually hyperextends by about 10 degrees, and you compare it to the other side and it does exactly the same. Next thing to do is to flex the knee. If we can move the knee up all the way to the top, nice and gently, making sure we're not causing pain, and then move the good knee and compare the flexion by looking at the feet. Any abnormalities, even a slight loss in flexion, will look like this, and this may signify a meniscal problem or slight arthritis. Put the knee back down and then into 90 degrees. And the next thing to do is to feel the knee, to palpate the knee, looking for any problems. Start at the top with the quadriceps tendon and work your way down over the patella and patella tendon, looking for patella tendonitis, specifically just below the inferior pole of the patella. And then from this position, either side of the patella tendon is the start of the joint line. It's easiest to feel, the space between the femur and the tibia, and work your finger along, looking at the patient. If that causes tenderness or pain, keep the finger there, extend the knee whilst pressing into this space, and if this increases the pain, it's likely to be a meniscal tear. This is the modified McMurray's test, and do the same on the other side. While the knee is in this position, it's easy to test the ligaments of the knee, and the first ligament to test is the anterior cruciate ligament. This is a ligament that stops the tibia moving forward on the femur. The easiest thing to do is to place a finger or thumb in the space between the femur and the tibia, so you're feeling both bones with your thumb, holding onto the tibia and pulling it forward, and you can feel any slight laxity with your thumb. The other test for the anterior cruciate ligament is the lachmans test. Easiest way to do this is to stabilise the femur over your thigh, and then use the other hand to pull the tibia forward, and you can feel any laxity if the ACL is damaged. Knee back into 90 degrees, and we'll test the posterior cruciate ligament by pushing the tibia backwards, looking from the side to see if the tibia moves behind the femur. The anterior edge of the tibia should always sit in front of the femur, and if it's at the same level or behind, it signifies that the posterior cruciate ligament is damaged. We'll then examine the collateral ligaments. It's important not to lock the knee out straight, but to just flex it, so we're not testing the cruciate ligaments, just the medial collateral ligament itself. I'm placing a valgus strain, so pushing on the outside of the knee, pulling the knee in. You can see if we can open up the medial collateral ligament, and you can feel the laxity, and do the same on the other side. It's important to compare on the other knee if you think there is an abnormality. And the last thing to do is just to move the hip, cursory examination of the hip, to see if this causes pain. Arthritic problems in the hip can be seen as pain in the knee. And that is the end of the knee examination.